I'm very pleased to have been invited. Thank you so much for the invitation. I want to start out with a quote from Dr. Tedros, which I believe really summarizes our point of departure. The arts can be a powerful ally in our quest to improve health for all. And I think this quote is important because it breaks down into two important components. First of these is the emphasis that arts can be a powerful ally. And it's important to emphasize this because we're not claiming to cure diseases. We're not claiming that the arts can come in and save us from infectious diseases, non-communicable diseases, even from the mental health crisis that many of our countries are in at the moment. The arts will never, on their own, save us from these challenges, but they can be a powerful ally. And I think that is the quest that we're on. That is what we're trying to promote and to get colleagues in the health sector to understand, that especially in mental health, where we're trying to move towards a mental health in all policies approach, we need to understand that culture, which has not traditionally been part of the health effort, that culture can also play a role here. So that's one part of the quote. And the second part of the quote here is the quest to improve health for all. I think what we have realized more and more, and perhaps many of us know instinctively, intuitively, is that the arts can be a leveler. They can be a social leveler. They can be a place of a stigma-free place where we can engage in health questions almost by accident. We can apply arts and health benefits to all for the benefit of all. Now, obviously, I do want to spend a little bit of time on the evidence base, because us being WHO and since we're in the space of health promotion and illness prevention, we want to be as sure as we can be that the work we're promoting is at the very least not having a negative effect, but hopefully also having a positive effect. And the evidence base for arts and health has really been growing substantially over the last 20 or more years. Particularly in the area of arts that with a therapeutic effect, we have made great strides in demonstrating that interventions like singing to improve lung functioning, or dancing to improve balance and gait for people with Parkinson's, hospital clowning to improve recovery rates, etc., that all of these are, broadly speaking, artistic interventions that are designed to have a therapeutic effect can be very impactful and very effective. But beyond that, we're also realizing that the evidence base supports the fact that the arts and cultural engagement can be important in promoting good health, promoting health equity, preventing illness, and, as I've mentioned just now, treating acute and chronic conditions across the lifespan. One of the key publications in this regard was a WHO evidence review, a scoping review that was published some years ago. But of course, science hasn't stood still. And since then, there's been an enormous amount of further evidence that has come to light. And soon we will be publishing, together with the Jamila Arts and Health Lab, a Lancet series that outlines the progress and also provides some thinking around what the future of arts and health might look like. Now, a second big question that policymakers often ask us when they become interested in arts or culture and health is around the health economics of these interventions. What are the cost savings? What is the social return on investment? Now, these kinds of questions are very tricky and difficult to calculate, to compute. And it is something that still needs a lot more work, that is true. But it is also worth saying that some significant progress has been made in this space, and in the end of 2025, an important report was published by the UK government looking at the cost savings of investment in culture as is. So through the use of, or through the existence of the cultural institutions that are prevalent throughout the UK, museums, ballets, singing groups, etc. So given the current cultural investment of the UK government, what are the cost savings and cost implications at a population level? And the report concluded that the estimated associated gains to the UK economy from improved health, well-being, and productivity as a result of that cultural investment is approximately £8 billion a year. Now, other countries are beginning to do similar modeling and finding similar numbers. And I think we can probably relatively confidently assume that as this evidence comes out more and more, as we see more and more that there are population level health benefits from engaging in the arts, that an investment in the arts and an investment in culture is also an investment in health. And the final important point, I think, that we tend to make when policymakers speak to us about why they should invest in culture and health, why they should invest in arts and health, is because it is something that people want. It is something that people intuitively understand. The link between artistic, cultural engagement and the resulting improvement in physical but also mental health and well-being is something the majority of people intuitively understand. And we know this from a Eurobarometer survey, a special Eurobarometer survey that was also published in 2025, which says that 87% of Europeans, and in fact 89% of young people, believe that cultural participation enhances emotional and physical well-being. So this is, I think, a critical piece of information for policymakers to be aware of, is that they're not trying to convince people that this is important. People instinctively, people intuitively know that this is the case. Now, finally, I think a critical point from a public health perspective, if we're trying to convince ministers of health or even other policymakers in this space, I think it's super important to be aware of the trajectory of public health, how public health has been changing in the way that we think about it and conceptualize it. Whereas before, public health was in its heydays, in its infancy, at the beginning, when public health was first conceptualized, it was mainly about sanitation. Then it turned mainly towards pharmaceutical care. Then it became institutional hospitals, and then it became something that it's expanded into the social determinants of health. And now we realize more and more that the conditions in which people are born, live, play, and work are in fact predominantly responsible for the health and well-being that an individual experiences. And this is culminating in work like a recent WHO Commission report on social connection, which says, for instance, that loneliness affects nearly 1 in 6 people globally and causes about 871,000 deaths annually. And now we begin to enter a space within public health where we realize that we will never have a pill against loneliness. We will never have a vaccine against lack of social connection. These are challenges that need to be addressed throughout policy, throughout government, and throughout different sectors. And these are exactly the kind of places where a highly functioning arts or culture on prescription system can support people and can support their mental health. So we have kind of entered into a phase of public health where we can no longer ignore the value of that culture plays in relation to health and well-being. Now, I want to take a quick moment just to say a few things about some work that we've done since the publication of the 2019 report. We've tried to focus a little bit more on particular topics in relation to arts and health, focusing, for instance, on intersectoral action. I should have said this at the beginning. I have QR codes for most of my slides, and I'm happy to share the slides later. In case you want to follow up on any of these publications, the QR codes will take you to them, and you can read more. I won't say too much about each of these policy briefs other than to mention their general topic and theme. So we produced one on intersectoral action, the value and need for cross-sectoral action between arts, between culture and health. We had a policy brief on forcibly displaced people, looking at how arts and cultural activities and interventions can help with mental health and psychosocial response in relation to forcibly displaced people. And most recently, we published a report on climate change, looking at how arts and culture intersect with health and climate change at every level. And in fact, that our climate crisis is in many ways a cultural crisis that we need cultural attention on as much as we need scientific attention on. And finally, we're readying a policy brief on youth mental health, a topic that comes up repeatedly in many forums that I'm in, acknowledging the significant mental health crisis that young people are currently facing ever since and probably before COVID. So I'm just going to conclude with a few thoughts around points of action that I tend to recommend whenever I have the chance to speak to policymakers and institutions and stakeholders at large, people who are interested in the space and who want to drive it forward. I was part of a fantastic European Commission process called the Open Method of Coordination, which we will probably hear a little bit more about during this webinar as well, which produced a report on culture and health called Time to Act, where it surveyed the evidence, surveyed the momentum in the space, and made some recommendations to EU member states about what to do next. And really, written large here is the need to develop and integrate arts and culture into strategies. We heard just before I came on from our previous speaker about the mental health strategy and how in Estonia and how arts will find arts and on prescription, culture on prescription will hopefully find a space there. That is critical for the mainstreaming of culture and health. But we also need to start thinking about more national structures about culture and health, how to integrate culture into health and health into culture. Because as is always the case with intersectoral work, it can very easily fall between stools, between responsibilities, if we don't create the strategy that binds it together. And part of that strategy is about creating institutions, places of expertise, where the arts and health research, evaluation, cost-benefit analysis, and promotion can sit. In many countries, like the UK, for instance, where arts and health or culture and health have successfully grown, it is in no small part to an institution that has been formed that is responsible for focusing that effort and that growth. The other thing I want to highlight is as arts and health, as culture and health becomes mainstreamed, we need to think about how we monitor cultural participation and its health outcomes. This is something that hasn't been done regularly in household surveys or at the national level. There's plenty of research now that is showing us that just engaging in the arts, just engaging in culture, even if there's no intended health benefit behind it, nevertheless is good for you. Just like physical activity is good for you, just like healthy nutrition is good for you, engaging in culture and the arts is good for your mental health and good for your physical health. And we need to monitor that, and we need to be able to statistically to support that kind of thinking and that kind of investment. So monitoring, I think, is a critical thing that we want to start fleshing out a little bit at national and also regional levels. And finally, perhaps even most importantly, it's worth reminding ourselves that we are working in an inherently engaging space with inherently creative people, with artists, with cultural institutions, with people who thrive on creativity. And that's something that we need to really, I think, make part of this movement. I have a picture here of Healing Arts, a campaign that the Jamil Arts and Health Lab, in collaboration with WHO, has tried to promote in various locations across Europe and the world. And it's really through these kinds of campaigns and engagements that we bring attention to this field, and that we can experientially show what arts and health is actually about.